Hi everybody. So I decided I was going to make a video just because when I was getting ready to have my own surgery, I was looking for a lot of information and I watched a lot of videos and I found it to be pretty helpful in what to expect, and it also helped me figure out some of the things I would need to use while I was recovering. A little history. I had an L5-S1 anterior lumbar interbody fusion and posterior lateral fusion as well. I was supposed to have a spinal nerve decompression, but the surgeon told my husband since it went so well, he was able to get 2 spacers in, and that completely straightened out my spine and lifted it right off the nerve, so he didn't have to go in and do the spinal nerve decompression. I had my surgery 8 days ago, and I have an incision in the front lower area, like a C-section incision it would be. I have 2 smaller incisions on my back, which is up a little bit higher. I stayed in the hospital for 1 night. Actually did better than I thought I would. The pain was definitely more than I was expecting, and I just want everybody to be okay with knowing that you're probably going to be in a lot of pain. I don't want you to have, expectations that somehow it's not going to hurt or you're going to be okay. I don't even remember going to the operating room. I'm an actual surgical tech, and a friend of mine did my anesthesia, who used to work with me at the old place. And she did such a great job. I don't even feel like I had surgery until I woke up in pain. My history, I was a very active kid. I did a lot of gymnastics when I was younger. I worked in EMS for about 10 years, so I was lifting really heavy patients quite a bit, and I remember I had hurt my back at work, and they x-rayed it, and they discovered I had a stress fracture in my L5 area. They told me it was normal being a gymnast, that if you actually x-rayed the backs of any other gymnasts, you would find the same stress fracture, so I really just didn't worry about it and didn't think much of it. Over the years, as I aged, things got a little worse. I ended up getting real bad health problems like 15 years ago. I had a lot of pain, couldn't get out of bed. It turned out they said it was fibromyalgia, and then later they thought maybe I had rheumatoid arthritis. Come to find out, I actually had chronic Lyme disease, so I've been dealing with that for a long time. But so then recently, about 2 years ago, I started really having some issues. I had a hysterectomy 2 years ago, and ever since then, everything just started going downhill quite a bit. My ankle actually started really bothering me. That was the first real symptom I noticed. I mean, I would have some back pain here and there. I had some trouble with my SI joints over the years, but as a surgical tech, I stand on my feet all day long at work, 45-minute lunch, no breaks. That takes a big toll on your lower back over time as well. I was also on chronic prednisone, which can soften up your bones. So when they finally did x-ray my back, they found another stress fracture on the other side of my L5 vertebrae. So I really have no idea how I got that stress fracture. Could just be getting older, or I did fall off a staircase on ice about 10 years ago and landed on my butt and actually thought I broke my butt pretty good. So I don't really know where it came from, but it just progressed and got worse. And with the ankle pain, I just thought maybe they positioned me wrong during surgery, if maybe somehow, it just was in the wrong position and it pressed on a nerve. So I went back to work after a 3-month recovery, and just standing at work was pretty tough. I was starting to get some pinching in my lower back on the left side. And then I just dealt with it as best as I could for a while. And then about a year ago, It was the end of May. It got really bad. Like, going to work was literal torture all day long, standing there on my feet. The pinching was so bad. It went, down my butt. Sometimes I felt it in my knee, and then my ankle. It was the top of my ankle, like right where my foot attaches to my leg. And then over time, it just progressed. I was getting nerve pain in my foot, burning, tingling, numbness. So they pulled me out of work for a while back over the summer. I ended up getting a nerve injection. Finally, it took all the way until when was that? October that I got the nerve injection, and unfortunately, it did not help. It actually made everything worse. I went back to work the day after they did it, and the next 3 days were just so bad at work. I was literally in tears, crying when I went home at the end of the day. And I called the doctor's office, and they put me on gabapentin at that point, and that did help calm some of the nerve pain down, especially like that went down through my buttocks. It just really didn't do much for the ankle pain, and I was actually starting to feel like my hip was broken or something walking around. I would get like pulling in my groin area, just not fun. So I finally went to see a third surgeon for a third opinion, and he said he really thought I needed the fusion. So here we are. I decided to just go ahead and get it over with and try to get my life back, because I really have not had much quality of life in the last year. I'm just trying to do, minimal things and trying to live life and go out and have a good time or walk around or do anything. I couldn't walk very far without the pain getting really bad. I would actually have to get down and squat because I just couldn't stand there any longer. So we went ahead and did this, and all of my nerve pain's gone. I actually feel pretty good. I stayed, like I said, one night in the hospital. My surgery was at like 10:30 in the morning. They got me out of there within 2 hours, and I was up to my room by 2 o'clock. And with COVID, visiting hours were only 2 to 6, so my husband had to drop me off and couldn't see me again till 2. But it worked out that I came out of surgery just in time, and I woke up and there he was. So that was really great to see him. So I had a catheter in overnight. That was actually very convenient. I wasn't sure how I was going to feel having it in, but I didn't really feel it a whole lot. There was one point it backed up a little bit, and that was the only time I really kind of felt uncomfortable. But it was really nice not to have to get up and go to the bathroom, because I was in quite a bit of pain when I woke up. They had me on Percocet, and then they were giving me some Dilaudid to help with the pain. They also put me on muscle relaxer. I didn't sleep a whole lot the first night. Like, I would fall asleep for maybe 15 minutes, and then I would actually like jerk awake. I'm sure it was from the medication, but it would feel like my bed flipped over or something, and I would sleep for 15 minutes, jerk awake, and then stay awake for probably another 45 minutes, and then try to lay back down. But probably about 4 or 5 o'clock in the morning, I think I finally got like an hour stretch of sleep. I'm a side sleeper, so I was worried about that. I didn't know if I was going to be able to lay on my side at all, and I asked the nurse about it, and she was like, oh yeah, we'll come in and get you over onto your side and prop you up with some pillows, and it shouldn't be an issue. So that was nice to be able to actually lay down to try to get some sleep. The next morning, they took my catheter out at like 6:30 in the morning. And then they got me up to go to the bathroom about 2 hours later. First time I stood up, I had the walker, of course, and I did feel a little dizzy and lightheaded when I stood up, but I fought through it, got to the bathroom okay, and then they took me for an x-ray, and then PT came in, and they took me down the hall. I walked pretty well. I walked up a little flight of stairs, and they actually had a piece of a car in the room to show me like how to properly hold on to the sides and how to boost myself back into the car seat. So that was helpful. They were very nice. They took very, very good care of me. I came home around noon that day. And then I was just basically in and out of consciousness. They put me on Oxycontin. I really didn't like what the medication was doing to me, and I just kept falling asleep. My husband thought it was pretty funny to take pictures of me sitting in the chair drooling on myself. Like, I was literally in the middle of like scrolling through Facebook, and I would fall asleep and wake up with my phone still in my hand, and I have no idea if I hit buttons or if I liked things I shouldn't have or not, but that really wasn't too much fun, and I decided to try to just control my pain with Tylenol. Unfortunately, it wasn't really enough to take the edge off, but I preferred to be in a little more pain during the day so I could stay awake and function a little more, watch TV, interact with my family. And then I just took the muscle relaxer and the Oxy full strength at night, and I slept pretty good. I got a body pillow, which was very helpful. I can lay on my side still, and my husband would tuck the pillow up behind my back just to kind of prop me up a little more, and it was nice. I felt like I was in a little cocoon or something laying there. So I would sleep like 4 hours, wake up. I set an alarm the first night so I wouldn't sleep through my pain medication, but then I would be spending the next 10 minutes trying to roll over to turn off the alarm because it kept going off. And, moving back and forth was pretty hard, especially the first couple of days. So I would take it at night, just take a half a pill during the day, and that seemed to help more. I was taking some Tylenol in between. I had my surgery on a Wednesday. That Friday I called the doctor's office just to let them know that, I was still struggling with some of the pain, and they ended up putting me on a steroid Medrol dose pack. I was not aware that you can't take anti-inflammatories. I guess it can actually affect your fusion. So she told me not to take any ibuprofen at all. Tylenol is okay. It works, but I always prefer, the Advil and stuff. But just dealt with it. I found actually getting up and moving was better than sitting still. I would get a lot more stiff when I just sat still and did nothing. I did walk my neighborhood Friday. I didn't walk real far. I walked maybe a quarter of a mile down the street with my walker. 2 days later, I walked actually around the block with my walker. No, actually that was on Monday. So I was like 5 days post-op when I took the walk around the block. Tuesday it was really nice here. So with a nice, 65-degree day, I decided to walk down the street to where my brother lives, which is probably about a half a mile. I walked with my cane and just took it slow and easy, but it felt really good to walk. Like I said, you definitely get more stiff just sitting around and not doing a whole lot. So, yesterday it was a week, and last night I finally felt pretty darn good for a change. Usually by evening I would feel the worst. That was when a lot of the stiffness would kick in. My pain would be a little higher, probably because I was a little more active during the day. I would stand around a lot. I would, walk around the house here and there just to get out of the chair and get moving. And I've also found, I'm going to tell, especially for the girls, if you can get some really nice long nightgowns or even maybe some casual dresses to wear. I've found that wearing pants is very uncomfortable. With my incision lower in the front and the incision a little higher in the back, it's just like no matter where I put the pants, it's hitting one of my incisions and it makes it uncomfortable. So I would suggest that you try to get something that's more comfortable to wear at home. I ended up putting on a nightgown last night and felt really good for once. I bought a shower chair. I haven't Other than the first time when I took a shower Friday, my husband helped me take a shower. That was the only time I used it. I have been able to get in and out of the shower myself okay. And I just need a little help getting dressed when I'm done. I also bought one of the hand graspers, which has been extremely helpful because anytime I drop something, you know, I can't bend over to pick it up. So it's been handy to have that around to pick things up, especially you know, when I'm home alone for a little bit. And a neck pillow was extremely helpful, especially in the hospital, because you know, just sitting up, you know, you're falling asleep a lot, and it just helped, you know, support my neck. So when I kind of passed out, it didn't matter. And I'm trying to think what else I bought. I mean, the walker I used the first couple of days. Don't really need it now, so if you can, I would pick one up. If you could find one cheap or borrow one from somebody. It was just it's more helpful like when I went to the bathroom, because, you know, getting down that low of a level and then trying to stand back up was pretty hard. And most of the time my husband just stayed in the bathroom with me, and he would, you know, literally wrap his arms like up around me here and just pull me up, and that was a lot helpful. And I bought a wedge pillow. I haven't used that for my legs. It was just too high of an angle for it to be up at. And I mean, the cane's helpful too. But so far things are going pretty well. I'll probably try to do another update in a week or so. I go for my post-op visit next Wednesday. So I'm hoping I'll get the all clear to start doing a little more and see where I'm at. So I hope this was helpful, and to anybody who's, you know, planning on doing the surgery, is definitely worth it. And I can tell already that there's a huge difference, and I can't wait to get my quality of life back and go back to work in 6 months and just be able to stand and not be in pain all day. So have a great day. Bye.